slaves anymore because we're not slaves. If you cannot control what you eat, then you cannot control what you feel. Eat your largest meals in the middle of the day, not the end of the day.
What part the homeostasis plays, you're on your way to healing yourself. The homeostasis is the internal environment where your body is at its ultimate functionality for healing. Just keep in mind that everything that is happening to you is happening for you.
Hello, and happy Saturday to all. I am Carolyn Gentle, and you are in the Mind of Nature, hosted by Dr. Zarif, the nutritionist. And today's topic, we are going to be talking about eating disorders and disordered eating. So thank you all so much for joining us. This is a pre-recorded live. However, like Dr. Zarif and I told everyone before, we come to you even if we are not live, we are still here delivering the information. So please go ahead and share the live. We will be streaming on YouTube and on Facebook. And also we will be in the comments on either YouTube or Facebook, answering comments and just communicating with you. So please go ahead and share the live. And if you have not already, please subscribe to the YouTube channel. It is Dr. Farid Zarif. So Dr. Zarif, go ahead and join me here on stage so we can get the party started. Hello.
Hey, what's going on? What's going on, everybody? It's good to see you. Man, we're going to have a great one, Kara. This is really great because we're talking about eating disorders and disordered eating. Now, most people have heard of eating disorders, but what is disordered eating? So when we get the chance to share a little more knowledge, this makes us a little more, it gives us more tools to work with. So in other words, you know, instead of us just saying, I just didn't know, or I only knew one answer to it, we have a variety. And that's what's so beautiful about knowledge. Knowledge is powerful when it's applied. When you take action, you make it work for you. You're not just knowing something and not using it. So as we always invite you to do, is to take what you're hearing and put it to test. Research it. See if what we're saying to you works for you in your life. See if you can find studies on it. What else how can you further the information that we're giving you? As always, we let you know or remind you that we're here to inspire you to elevate. We're here to also update, and we're here to educate. So these are some of the pillars in which are the stability or the premise in which we speak from. We want you to also invite other people, because we're talking about the saving of or making aware of these different diseases, infections, disabilities, and so forth. And there are some things that if you move on them in a timely manner, that perhaps you can defray or you can avoid altogether some of the things that we're talking about as far as those infections and illnesses. We are people that are very strong. We have a very strong community. And as we are seeing and feeling all of the energy that's coming from Kamala Harris, for instance, now, and other the young brothers and sisters that are really, I mean, saying it loud and being proud. And the world is changing right before our eyes. It's not like it used to be, just like, you know, whispering about things. We really need to speak up. And that's why that's why I care. That's why we are here on the Mind of Nature, to push the idea of being healthier, of being aware and talking about these things, not to preach to you, because that's on you if that's what you think is happening. But what we want to do is teach to you so that you will add to your already brilliance. And right. Then after that, we will make better decisions. Um, for those of you that don't know me, I've been around the community. Nobody has to tell me to go back and give to the community. I've been doing it all my life, starting in Detroit and now right here in Los Angeles. This is a beautiful thing that I get the opportunity to do. It's a privilege to serve you. So please take advantage of it. So with that in mind, let's go ahead and we'll go back to Care, and then we're going to come back to me and get into the subject.
Absolutely. As Dr. Zarif mentioned, he's here to update, educate, and just keep us is eating disorders and disordered eating. All right, Dr. Zarif, take it away.
The reason I just popped back up that we had a technical difficulty. Your voice had just stopped altogether.
Oh, okay.
Okay.
Am I clear now? Am I good to go?
And you're frozen there for now. So we'll just go ahead. Oh, now you're moving. Good. All right. I guess our computers are. We have a little technical difficulty there, but Care, if you don't mind, repeat, just surmise what you were saying earlier. I want to make sure everybody heard that, please.
Absolutely. I was just saying to make sure everyone, if you can share the live, and just also remember Dr. Zarif is here to update, educate us on the information that he's given here. Like you said, he started off in Detroit. He's been doing this for over many years, over 50 years. So, let's go ahead and get this information. Absolutely.
That's all my life. I'm just gonna start saying all my life,
right.
Because I know, like, if you're doing something for 50 years, people are like, 50 years? Wow. Older people, of course, they can relate because, we're like in the same age range. But the idea is just knowing this has really helped me to maintain my youth and my strength. And, it's really beautiful. I've met other people that take care of themselves. You can bet your bottom dollar that if you see a person and you compare, it's easy to compare a person that is taking care of themselves and a person that neglects themselves. There's no doubt about it. So when you make the decision to take care of yourself, you can feel the difference, you look the difference, and you can be the difference.
Yes, absolutely. Absolutely.
So before we go on, you want to do a couple of shout outs and then we'll go for it.
Whenever it is, as mentioned, a pre-recorded live, I shout out everyone and anyone that is here and a part of the conversation. So thank you all so much. As I mentioned, Dr. Zarif and I will be in the comments and just commenting with you. So here we go, Dr. Zarif, take it away.
All right. We're talking about the eating disorders, and we're also talking about disordered eating. And when we talk about the two of these, they sound very similar. But as we go along, you will find out more and more as we talk about disordered eating and eating disorders. Now, first, let me explain to you what a nutritionist does. And a lot of times registered dietitians do the same thing, but they might have a more clinical approach, like if they're working in a certain specialty or a certain focus, then they work according to that focus. For instance, if it's obesity or bariatrics, those nutritionists or those dietitians will work on or with the knowledge of things that are pertaining to obesity. If the person is working with maybe a person that is having difficulties with eating a certain way, and those are disorders, so that'll be their focus. Just eating disorders doesn't mean that's all they know, but you can see how you can easily categorize each nutritionist or registered dietitian. Now, nutritionists, we're professionals, and that there are people that are nutrition enthusiasts. They're interested and they have some knowledge of nutrition, but people that I consider nutritionists are those that have put in the hours, the many thousands of hours to help increase their knowledge base on what they're teaching, or the use of the treatments that they know to help an individual feel better and do better. We use our knowledge of chemistry and biology and genetics and histology and digestion and other sciences in order for us to ascertain the body's nutritional needs. Now, with nutrition, it's not just about what you eat, but it's about how well you sleep, how many hours you get. It's also about your physical activity, making sure that you're moving every day, not to stop the nonsense with I just do it when I feel like it. You do it every day, and you give your bodies the command to do it. You also want to be in a great environment, an environment that you feel loved and acknowledged and that you're important. And this is very important. A person stunts his or her growth when you're around people that don't show you love, and when you're around people that you don't respect. So be sure that you take the opportunity to select what environment you're in. And of course, the food that you eat is super important. And that food or the way that you eat should reflect your eating lifestyle. And your eating lifestyle is a way of eating according to the way that you live. So if you are, let's say, a person that does laborious work, like, for instance, you work on the highway, and those long hours, hot in the sun, lifting, pushing, drilling, all of those things, you may burn more calories, and usually do burn more calories than a person that's cerebral. And that means that a person that's just using their brain, like a professor or a doctor or so forth. So you'll have a difference in the use of your food that you eat, because the calorie intake is definitely, the requirement is different, and you want to eat according to the way you live. If you're a person that has the opportunity to meditate most of the day, and maybe just go put your feet in the water and have something to drink and have some people over, and you have a little talk, and then you go back to resting, and one of those kind of hardly any physicality there, but you're very cerebral, then you would also require less food. So let's move on, where some of the nutritionists are especially trained to address disordered eating and eating disorders. The nutritionists working in the disordered eating field provide nutrition, education, and counseling. Also, they create meal plans, and they provide accountability, motivation, and address the food fears and weight management concerns. Now, when it comes to the causes, the exact cause of eating disorders is not known. And keep that in your mind, because this is something that science just doesn't explain everything. So this is one of the cases. As the other mental conditions, there are, and there may be other different causes, such as genetics and biology. So there's a good chance that you were born with certain propensities to flu, disease, certain diseases, and so forth. That can be it can be congenital. You can be born with that. Then if we talk about the biological factors, such as changes in your brain chemicals, that also may play a role in your disorders. And a lot of that you'll hear a little more about the brain and how it relates to your behavior when it comes to the eating disorders and disordered eating. Okay. Now, next we have, want to make sure that, yeah, I want to go back to this. The mental illness, when we're talking about the mental illness, it's an umbrella term that, for a variety of disorders that affect the person's behavior, their emotional responses, or thinking, or a combination of these. Mental health issues are common. Now, experts estimate that 1 in 5 United States adults experience mental illness every single year. National Alliance on Mental Illness. You can find out more information. This is one of the sources that you can find out more information about mental health. And there's also a very good practice or approach called mental health by the numbers. You can also look that up to get a better understanding of mental disorders. Now, there are many different types of mental illnesses that range in severity. Now, anxiety and depression, or anxiety and some of the depressive disorders, obsessive compulsive disorder. You've heard that before, the OCD, eating disorders, and post-traumatic stress disorder are just a few examples of mental illnesses. And these disorders are diagnosed and they're treated based on the criteria outlined in the diagnostic and statistical manual of mental disorders. Now, the latest one out, you probably heard of the DSM-5, which stands for the DSM, the Diagnostic and Statistical Manual of Mental Disorders, Edition 5. And that's the latest one out now, unless one has come out while we talk it now, and it's issued also by the American Psychiatric Association. So this discussion, what we're going to do is we'll get a little bit into anxiety. We get into the mood, and sometimes, remember, I also did this presentation on mood, food, and how the food actually affects us as far as the way that we eat and the way that we express ourselves. So our behavior also is tied a lot into what we are eating. Anxiety is generally characterized by a feeling of tension. So when we're talking about anxiety disorders, we're talking about worrisome thoughts. You know, when a person is like, they call them worry warts, and this is when they have a lot on their mind, wondering how they can do something that they don't have control over, so forth. So also, let's include physical responses such as sweating or increased heart rate. And this is what happens when a person has a lot of anxiety. They move really fast inside. They're slower on the outside, but inside is just, is wreaking havoc all over the place, because many of them actually feel responsible or not in control, and these kinds of things to make them continue to behave in such a way. Now, people who have anxious or anxiety disorder often deal with recurring intrusive thoughts, unwanted automatic thoughts. So this is called the auto suggestion. And what are you saying to yourself over and over? What are you thinking constantly? Now, this is very important because it's easy to get stuck in your head, and it can cause great distress and anxiety. So there are 4 main types of anxiety disorders. One is generalized anxiety disorder, or GAD. And generalized anxiety disorder is defined by chronic worry. So if you have a friend, or if it's you that you chronically worry, as well as physical symptoms associated with anxiety, often occurring without a particular trigger. So these are things that you just do and you've been doing over the years, and that is just generalized anxiety disorder. The next disorder would be obsessive compulsive disorder, or OCD. That involves recurring unwanted thoughts and repetitive behaviors such as cleaning surfaces or hand washing, often performed to just alleviate the distress. And that's why you will see people doing some of those behaviors. Also, they may have the fear of germs, like they'll call them a germaphobe, and that are people that are severely tied up in the thoughts of or the feelings of being nasty or affected by germs. They can caused by intrusive thoughts. It doesn't have to even be existing at that time, but because of the behaviors and the repetitive thought, this is what people experience. Next disorder is panic disorder. Panic disorder is characterized by repeated episodes of intense fear or panic attacks leading to physical symptoms such as chest pain, heart palpitations, and the shortness of breath. All of this is a part of panic disorder. Some people feel like they can't breathe, or they feel like their heart is going to stop. They feel the chest pain. There has to be something in there. But what happens is that once the emergency techs come out, or if you're rushed to the emergency and they tell you that, oh, you had a panic disorder. And this is why, because a lot of these repeated episodes is because of the intense fear, the phobias, and we'll go into that later on. Now, another disorder, and I think this is the fifth disorder, is the social anxiety disorder, sometimes called social phobia, it causes people to be overwhelmed with anxiety in social situations. A lot of people's social anxiety disorders when, the people that just don't like to be around crowds, they can handle 3 to 4 people and talking and sharing beverages and so forth. That's a different thing. But a lot of crowds, like you see, for instance, if you're in a concert and you have just swarms of people surrounding you, that can be very, very hard for a person that has social anxiety disorder to get through. And you've also heard people say that person is inhibited or introvert. And those are other things. People can be like an introvert, but they can also be around a lot of people. Whereas when you get a social anxiety disorder, it varies with what's going on, how many people, and how does that person feel at the time. Now, some of the special phobias. A phobia is an irrational fear. I want you to know this. Again, we're coming back to the brain, but we won't spend a lot of time. I want you to keep this in mind. Make note that a phobia is an irrational fear of something, such as a type of animal, blood, or situation, such as flying in an airplane. So some people, for instance, if they see a dog, and dog can be a nice dog, not even barking, but in their mind, oh, the dog might just jump on me and bite me. Or it might be a situation where a person is bleeding. The person is thinking the absolute most severe thing that could happen, and that's the person bleeds out and dies. Or such as dark places or an environment. Now, someone with a phobia, they can avoid the object or the situation and experience extreme anxiety when confronted with it. So when a person has phobia, know that this is real to them. This isn't, oh man, just close your eyes. this person feels it. There's people that are so sensitive and have phobias that are so severe about cats that they can't even look at a cartoon cat. They can't, even if a person sketches a cat and then shows them the cat, that's severe phobia of a cat. And then the same thing for people that have other fears or phobias. Now let's look at some of the eating disorders. And eating disorder is characterized by compulsive, unhealthy eating behaviors and is often associated with preoccupation, with a preoccupation with one's body. So if you have a eating disorder, or you might say body dysmorphia, and these are people that are not satisfied with the way that their body looks, the way that their body reacts to food. So there's a preoccupation with their body, meaning that they're obsessed, or they preoccupied with their weight or their size or their shape. And usually it's a situation that leads to serious medical consequences. Now, although an eating disorder is a mental health condition, it is also a physical one. Now, since severe disturbances in eating patterns impact physical health, for example, you have severe restriction of calories, and that's usually when you see a person that is anorexic, or you see a person that is restraining, or they're not eating at all, or they'll eat such a small amount that is nearly insignificant. Also, there are other examples in the case of I think we just talked about anorexia nervosa, but that can cause a decrease over time of bone mineral density and increasing the risk of fractures. So when you don't feed yourself these minerals, and that's the big thing. A lot of us been taught you don't eat food, then you'll lose weight. But if you don't eat food, you're going to lose minerals. You're going to lose the important nutrients that you need all over your body. We continue with anorexia nervosa and bulimia nervosa. Now, anorexia nervosa involves an intense fear of gaining weight or becoming fat. And you've seen this before, where people are all the way down to nothing but skin and bones, leading to self-starvation, because they also have cannibalism. And auto cannibalism is when your body starts to use your own flesh in order to survive. And that's those people that don't get help, and they get so sick that they're down to skin and bones. Now, people with bulimia nervosa eat large quantities of food. They binge, and that is just eating, and is followed by purging. So they're reverse peristalsis, or throwing up. And these behaviors, such as self-induced throwing up by using a finger or sometimes an object to make them throw up, excessive exercise. They'll work out and they'll stay on that treadmill or that stepper. The stepper is they want to they have a feeling that they have to make up for all the food that they ate, or the use of laxatives. Now, this is a very important one, because most people that think they're getting a detox, they're not getting anything but laxatives that's giving them diarrhea, or causing them to have a bowel movement. And sometimes it can be a violent evacuation there. When it comes to a binge eating disorder, those with binge eating disorder, or BED, eat a large amount of food in a very short period. So they often accompany it's often accompanied by the feelings of a lack of control and shame because they're embarrassed or they don't want anybody to know. There's a great saying, the deeper or your sickness is only as deep as your secrets. And that is very true. You want to have somebody that you can talk to, somebody, a professional that you can go to, ask your doctor about it, seek attention, start asking. I don't care if you go to your pharmacist and you don't have any insurance, go to a free clinic, but get some help, get out there. Unlike people with bulimia nervosa, they don't purge after they binge. So a binging eating disorder is a little different than the bulimia. Bulimia, when a person has bulimia, they do purge after they eat. But binge eating disorder, they don't. Okay. So let's go on to the next one. Avoidant restrictive food intake disorder. Now, that's avoidant restrictive food intake disorder is a condition that is characterized by the fear of eating certain foods that results in nutritional deficiencies. So some people may be avoiding, for instance, asparagus, or they don't like anything green, or they don't like anything yellow, or they don't like anything round, or they don't like anything that you chew on and the juice comes out of it, or they have all of these particular restrictive food intake rules. And you'll see people, we call it finicky. And you'll see children that are finicky. No, I don't want that. Why don't you want it? Because it's brown, or it might be it's orange or something of that nature. So these are real, and these can happen to anybody. Next is pica. Now, pica is an eating disorder also. This is where people have recurring episodes of eating non-food objects, such as chalk and metal coins, pebbles, or paper. So you've seen this on TV before or on special reports of eating disorders where a person likes to eat tissue, toilet paper, or eating paper, chewing on some paper. This is a eating disorder that could be in that category of the ones that just can't be explained. Then there's rumination disorder. Now, rumination disorder, when a person ruminates, usually means that they're alone and they're thinking. But in this case, rumination disorder involves repeatedly regurgitating food unintentionally, bringing swallowed food back up, or re-chew and re-swallow it. Oh, that's incredible, isn't it? But these are things that happens during rumination. Keep in mind, again, this is repeated regurgitation. And this is when the food is unintentionally re-swallowed and re-chewed. And this is something that some people have that, again, may not be able to explain it, but the disorder is definitely real. Now let's continue with other specified feeding and eating disorders. Any other eating disorder that causes distress and impairs someone's ability to function at home or work by labeled work is labeled as an other specified eating and feeding disorder. So again, any other eating disorder that causes distress or impairs someone's ability to function at home or at work is labeled as an other specified feeding and eating disorder. Sometimes doctors can't reach a decision or a diagnosis, and it'll go under this particular other specified feeding and eating disorder. I think, to me, in my opinion, this is where COVID-19, this is part of that, needs to be under other specified uh, um, difficulties or disorders and illnesses. Let's go to the disordered. Again, some of the things, just to give you an idea, the disordered eating differs from disordered eating is different from eating disorders. Now, the criteria for eating disorders are established in a diagnostic and statistical manual on mental disorders, 5th edition, which is also called the DSM-5. And these patterns of disordered eating do not fulfill the criteria for an eating disorder. Even though some signs of disordered eating might exist. And that just simply means that you could be doing something every once in a while. You might want to, you play with chalk or something like that, or you bite off some chalk, or you might, the other little things that we're talking about as far as Pike is concerned, like the paper, so forth. But it doesn't mean that you have the disease. According to the mental disorders 5th edition DMS, that there are certain criteria, and if you don't fulfill that criteria for an eating disorder, you may not have that eating disorder at all. Okay, I'm going to take a little break here because we're coming close to the end here, and we're going to bring Care back up, and then we're going to finish up.
Absolutely. Thank you so much, Dr. Zarif, and thank you to everyone that's joined us here in the Mind of Nature. Today's topic is eating disorders and disordered eating. This is a pre-recorded live. Thank you all so much for joining us. Dr. Zarif and I have been in the comments just saying hi to everyone. We do appreciate you being here and tuning in every Saturday, 8 a.m. PST. Also, if you haven't already, please subscribe to the YouTube channel. The YouTube channel is Dr. Farid Zarif. We are streaming live right now, or excuse me, recording the stream. The stream is going out on Facebook and on YouTube. So thank you all so much for joining us, Dr. Zarif. If you can join me back on stage. I do have a question.
Okay.
Or this is something I wonder as far as with pica. So people, they have the urge to either chew or eat on chalk, or I've also seen like mud or like metals and things like that. But I wonder if when they eat on that, or like let's say they're eating on eating chalk, do they now say, "Oh, I don't like this," or is it still something that they enjoy to do?
From my experience, they enjoy it. They like, this is something that they find some kind of benefit in. For instance, maybe calming their nerves, or it might help them to figure out certain situations if they feel like they're in difficult spots. For instance, I don't know if you're so young, but years ago, like when people were getting nervous, they would show them on TV, fumbling around with cigarettes and getting a cigarette out, and they're shaking like that, and then they take a draw and like they just relaxed, right? Okay. So you got people thinking that smoking was a huge part of helping a person to stay calm. So these people that are that suffer from pica, they do the same thing. They use these particular things. Even those who chew on gravel, and those who like I said, the toilet paper. These are things that, and then there's people that also, especially people that have picked up salt. Like there's a box, I don't even know if it's sold anymore. My mother used to chew on Argo starch. Have you ever heard that before? It's a starch that people actually use to stiffen their shirts and, put starch in the clothes. But a person to take a person that has pica, and sometimes they don't have to have pica. It's just like one of those things that they're nervous condition and they believe that it's going to give them some kind of relief.
Okay. I think I said pica and you said pica. I don't remember how I said the word. Either way it goes, we know what we're talking about, but okay.
Mm-hmm.
All right.
Yeah.
Thank you. I appreciate that breakdown. Yeah, because I just thought of it as someone they having the urge in their minds to do it, but when they do it, it's almost like they snap out of it, because that metal that they're chewing on or want to chew on is not something chewable. So I thought about that. So thank you for that breakdown.
Yeah. They kind of just like going back to cigarette smoking. Like some people, for instance, they'll have a cigar, but they won't inhale the smoke. But the feeling of whatever that cigar gives them, like I'm in control, or I'm running this, or
Right.
I'm ahead of this, or I'm the authority, I'm the big man on campus. With those feelings, and they have the cigar, this is something that they really feel that they're in. Some people don't, if they feel like they don't have any control over some things, they go, they get batty. They just like, oh my goodness, they no control. And you'll see that in when people are talking to other people, and they if they lose control, they in their minds they'll do everything possible to think of something to counter that person, instead of to say, hey, let's collaborate.
Right.
They're like, no, I got to run this. And some folks don't ever get involved with things because if they're not running things, they feel that they're being talked down to, disrespected, or whatever that thought is. And that's
Right.
why they call these disorders.
Got it. Thank you so much.
All right. Well, let's get on back on into it, Care. We want to thank everybody for being here this morning, or whenever you look at this. Make sure you spread it. And thank you. We're in the 4 digits now. Yeah.
I had to jump back up to celebrate with you.
Yeah, you got to celebrate. That's so great. We've been really working hard, and we're getting up, and it's because of those of you that's working with us. Let's go right back into this. As I was saying, make sure that you spread the news, everybody. We are here to make history. We're not just going to be a little flyby thing that we used to talk about vegetables and fruits and nature, and then we disappear. We are here as long as we can have the tools that we've been blessed to use to come to you live, using these live streams, and technology just keeps getting better and better. We're going to bring you the news. Now, remember, keep in mind that a lot of people, the reason that it's difficult for them to sit through a program like this is because it is so much knowledge and it is so helpful. And we're so addicted to entertainment that it's very, very difficult for people to feel that they're not being entertained and stay in that place. So we have to just be patient and just say that we will be ready for you when you arrive. Let's go ahead and move on. I want to talk about this because this will really help you understand the difference between disordered eating and eating disorders. While disordered eating sounds strikingly similar to an eating disorder, the difference between them has to do with the severity of symptoms. Some with disordered eating patterns will fit the diagnostic criteria in the DMS-5 for a full-blown eating disorder. But it is also possible to have patterns of disordered eating, such as restricting the amount of food consumed, like we were talking about in anorexia nervosa, that do not rise to the level of an eating disorder. So that's pretty much in line with what we were just talking about. Disordered eating can be something that you do that lends itself to the similarity or something that is very close to or maybe leading to a disease, but you don't have the full-blown disease or the full-blown disorder. Okay. Now, signs and symptoms, like let's talk about restrictive eating. Restrictive eating includes minimizing the amount of food that a person eats. So usually when you're talking about a person with anorexia nervosa, this is the nervosa side of it has a lot to do with, just like bulimia nervosa and anorexia nervosa, they both involve regurgitating. Okay. So they'll eat that food, even if it's restrictive, they'll eat that, and then they don't want that food to stay in their body because they feel like it's going to, it's either too much or something that they just don't want in their body in relationship to the way that they think about themselves. Physical signs of disordered eating. Let's go down these. Now, this is disordered eating. The most common physical symptoms of disordered eating include significant fluctuations in weight, stomach complaints and pain, changes in bowel habits, changes in menstrual regularity, including stopped or missed periods, feeling dizzy, weak or tired, fainting, changes in skin and hair, such as being dry and brittle, acid-related dental problems, including cavities and erosion of enamel caused by purging, throwing up, and nutrient deficiencies. So keep that in mind. You got to keep coming back and playing this over and over. Keep doing it until you got it. Okay, let's go. Some of the other disordered, okay, I'll go ahead and pass that up. Some of the emotional signs of disordered eating. The most common emotional signs include being preoccupied with weight, food, dieting, calories, carbs, like carbohydrates, to the point that eating and managing weight become a primary concern over other activities. So this is the person that seems to complain about everything when they eat. No, I don't like it that cold. No, I take the raisins out. No, I don't like syrupy sweet stuff. Or no, I don't like anything from a carton. I don't know. You see, so all of that stuff. This is the person that may even, like, as far as dieting concerned. No, I do intermittent diet every day, or no, I have one keto meal a day. All of these particulars that can be pretty challenging. Not for just the person, but the person that they're hanging around with, okay? A person that they're in the company of. Let's go on. Being preoccupied with your body's image, like I talked about that body dysmorphia before. That's what that is being preoccupied with your body's image, your body size or shape, a specific part of the body, and weight. The other maybe another emotional sign is significantly limiting the variety of foods by restricting whole categories of food. Restricting a whole category meaning like, no, I do not eat any fruit. I don't eat vegetables. And this is a significantly limiting behavior of foods, the whole category. Wow. Or only considering a very small number of categories of food that are safe to eat. So you do have people, and you will see these people particularly on YouTube or in videos, where they'll say things like, oh, I don't ever eat oranges. Oranges is that fruit right there they'll have some category for that fruit, and they won't eat it. And then anything that looks like that fruit, they won't eat that either. They might have something, oh, I don't eat little fruit. The fruit that is small, any fruit that's smaller than a half an inch, I don't eat it. Things of that nature. Things that we also see that people will say things like, I do not eat any watermelons without seeds. Oh, that's a big one, isn't it? Because now they're only speaking from choice. Because if you're starving and a person presents to you a watermelon with or without seeds, you're going to devour it. So you have people that are saying that they are not eating that food, but they're not not going to eat anything that looks like it. They don't want to have anything to do with it, and for whatever reason, that food should not be eaten. And they might say it's a hybrid. They might say that because it was they grow it a certain way, or there so many reasons why. Also, as far as emotional signs, you might performing specific food rituals. You have people that perform specific food rituals before they eat the food. They might have to go and wash everything, let it soak, wash off all of the suds, let it dry, and then eat it. You might have other people, they'll go absolutely berserk if they eat a grape. Like when you eat a grape off the vine, they're not rinsed and have the rain has washed them off and all that. There's a good chance that you're going to have dirt. Remember, the grapes are outside, so you might have dirt on the grape. So people that are really particular about the foods that they eat may be in this category. Lastly, withdrawing from social eating activities. That is that, and I have a little bit of this because when I withdraw from social eating activities, meaning that I just don't eat anywhere. I always like to eat before I go places, because in my mind, I'm thinking about the aerosol coming from people that are preparing the food. And that really turns me off, because my mind is very vivid. And when I see this, I'm like, no. Now, I know my own aerosol. With my aerosol, I don't worry about that. It's me. But when I am being served a salad or a soup or what have you, and a person is talking over my veggie burger or whatever I'm eating when I'm out, that's a big turnoff for me, and it can be a big turnoff to other people too. Okay, let's go ahead and check here. Good, we're getting close to. I wanted a couple of more things. I want to definitely just squeeze it in. Remember too, you can listen to part of these presentations, a part of it all through the day, and listen to it with somebody while you're cleaning up. Remember, you can also do other things while you're listening, because this is a very, very important and very, very informative information. You get you get a lot of information, and these presentations come with a lot of courage. They take a lot of study, and they really take a little time. Because I'm being concise, and Care is being concise, and that's one of the things that we like to do. For those of you who don't know, concise means straight to the point. We cut it down. Okay, so that's what we want to do. Let's go ahead and talk about the risk of disordered eating. Let's go with the people who have disordered eating patterns. They might not immediately see the impact of their eating habits have on their physical and their mental health. However, complications can indeed arise in disordered eating, such as a greater risk of obesity and eating disorders, bone loss, gastrointestinal disturbances, electrolyte and fluid imbalances, low heart rate and blood pressure, increased anxiety, depression, and social isolation. Who's at risk of this disordered eating? Anyone can develop the habits of disordered eating. However, there are some risk factors that may increase the likelihood that a person might develop disordered eating. Some of these risk factors include dissatisfaction with one's body, dieting from the purposes of weight loss, ADHD, adverse childhood experiences such as abuse. Reach out to your healthcare provider if you have any of these, but you reach out to your healthcare provider to find out whether or not you're facing any of these risks. It makes a huge difference for you and your loved ones. Okay, good. Okay, we got a few seconds left, and I'm going to just let you know where you can seek help. You can ask yourself these questions to determine if you need help first. Do you use food as an escape from stress? Do you use food as an escape from stress? Does the number of your weighing scale affect your thinking? Like you look down and you see 210 and you really want to weigh 180. So ask yourself that question. Are you constantly thinking of food, and do you binge eat? Now, if your answer is to yes to those, or you don't know the answer to those, you need to seek help. Now, the treatment is the people who suspect that they have a disordered eating can seek treatment with a mental health professional. A psychotherapist or psychotherapy can help people understand their relationship with food, achieve body acceptance, and explore the relationship patterns and other psychological issues that contribute to disordered eating. Often people with disordered eating do not realize that their eating patterns may be harmful. Now, registered dietitians, nutritionists, and other healthcare professionals are equipped with or equipped to help you with struggling with disordered eating patterns to gain insight into their outlook on food and prevent disordered eating from progressing to an eating disorder. Remember, again, it's different. Disordered eating can progress to an eating disorder, and that's the difference between the two of them. All right. In summary, the disordered eating patterns include restricting the quantity or the type of food you eat, eating compulsively, and other unusual eating patterns. Typically, disordered eating does not meet all the criteria for the eating disorder. So that means that if you're just doing some of the things and not all of the things, you may just be okay. But it's still good to get a checkup from a healthcare professional, including primary care physicians, psychologists, psychiatrists, social workers, registered dietitians, and nutritionists. All of these people can help you with those situations. Now, I want to thank everybody for being very patient. This has been great, another really great one. And I'm so glad that we had a chance to be here. Remember, just put your questions in. You're going to have some questions. Write those down in your comments. And although we won't be here live, we will be in motion. So while we're wherever we are, you will be able to get some kind of response to that. Care?
Yes, absolutely. And I just want to say great information as always, Dr. Zarif. You mentioned social eating activities, and that's something that I definitely, I have to work on as well. I know just switching over and eating in a different way kind of interrupts, or I wouldn't say interrupt, but gets into that as well in that category. So great information, as Dr. Zarif mentioned, have invite someone to look at the information with you. this is going to be recorded, or it is recorded and will be on the YouTube channel. So you can always go back, pause, write your notes, and just get the information in, because it's really great information to learn. And I know, like you say, it can be a lot at times. So that's why we have the option to pause it and rewind and do those things so we can get it, because that's what it's all about, getting it.
And thank you. I love the part that I always have, like, parts that I really enjoy. And the part that I enjoy is that people that never heard of eating disorder, and most likely people have, but there are some people that haven't. But the eating disordered and disordered eating, that it really, I think I made that clear to say that if you're doing something that may be one of the behaviors of criteria, like, for instance, if you have the disease, you got to, let's say, anorexia nervosa. That might be body dysmorphia coupled with restrictive eating, coupled with some kind of other mental disorder, another mental disorder, and another eating disorder. Those, when you have at least 5 of those, you know that you have, that's when you consider being having that the actual disorder. That's you having the eating disorder. But just because you ate a little chalk one time, oh, I'm doomed. Don't do it to yourself.
And that's something too, because I think we start to think like, oh my God, I know I've chewed on some, I don't know, salt before or something like that. And it's like, you start to diagnose yourself, hear that information. So, again,
don't do it.
Right. It helps with the education for sure.
Definitely. I know if I, I'm doing something in the bathroom and I don't realize that I'm chewing some toilet paper, I know I'm going to say, uh-oh, what is going on here? Right. So, we're really, really happy you joined us today. And this is, remember, pass on this information. It's a lot of information, but it can change your life.
Yes, absolutely. And thank you to everyone that joined us here in the Mind of Nature. Our mission is to elevate, update, and educate. That's what we do here in the Mind of Nature. I see that I'm frozen right now, but that's okay. Can you still hear me?
Can still hear you, yes.
All right, so I'm gonna keep going.
All right.
We are here every Saturday, 8 a.m. PST. Again, thank you all so much for joining us. So much appreciated. Dr. Zarif, do you have anything?
We'll see you next Saturday at 8 a.m. Thank you very much. Pass the word, pass the word, pass the word. You heard?
Yeah.
I'm Dr. Zarif and my co-host,
Carolyn Gentle. Thank you so much for joining.